Hello, I'm Dr. Mark Newman, and I'd like to welcome you back. I hope you're enjoying great health. Remember, we know that when you change your health, you'll change your life. Our goal for you is to add years to your life and life to your years. A lot of you patients come to us for testosterone therapy. We still have lots of questions, answers, comments, thoughts, and processes, so forth about what this entails. So I'm going to take some time again. We're going to spend a couple weeks here talking about the benefits and maximizing those effects of testosterone therapy. So let's get started with part one right now. I want to remind you to join me next week when we talk about more topics concerning your health. Okay, for those of you that have been following us, remember we talk about the normal course of aging is a slowdown of metabolic and physiologic functions. So generally, when people come to us talking about looking for the benefits of hormone therapy, whether it be male or female alike, they're going to have a long list of complaints, and those could include fatigue, loss of energy, weight gain, inability to lose weight, loss of muscle mass, loss of their joy, their zest for life, a loss or slowdown of their libido, increased body fat, brain fog, mood changes, difficulty with sleep, increased aches and pains. It can be a long list of those things. And of course, that might not mean that you have a hormone problem, but it's certainly one of those stones we're going to look under for you. So first and foremost, we always say, to see is to know, not to see is to guess. You've got to measure. Now, we do a variety of labs, the things that we really want to focus on, especially for our men when we're looking at their hormones. We do a study that we call a free testosterone index with the lab we use, and that's going to look at the total amount of testosterone, their free testosterone, and sex hormone binding globulin. Those are the minimal things you want to look at when you're looking for testosterone balance or imbalance. Those are all important players. Secondly, we need to look at the estradiol. Estradiol is the female component of hormone in the male body. We need it. It needs to be balanced. And then number three, we're going to look at a blood count, meaning a CBC, red blood cells, hemoglobin, and hematocrit. Those can be important players as well once we start the therapy. So remember too, we always tell you, we treat the patient, not the number. So if a patient comes to us and they have the signs and symptoms that we mentioned, we're always going to measure, look at those numbers, and make recommendations based on that. And oftentimes we'll tell that patient, here's your numbers, this is what we recommend your levels be. So I like to do around an 8-week course of therapy and then revisit the numbers, revisit the patient, and find out how they feel, what types of effects they're feeling from that hormone therapy. And remember, we always tell you, there's never a free lunch. Hormone therapy alone will improve your signs and symptoms. But to maximize those benefits, be you male or female, we always tell you, number one, resistance exercise. And I always stress it this way. I say resistance exercise helps multiply the effects of testosterone therapy. Number two, diet. Very important. We try to keep it simple. I tell you, focus on protein, vegetables, fruits, nuts, beans, healthy oils, things of that nature. Minimize or eliminate grains and dairy. Those tend to be harder for your body to digest, assimilate, and utilize, especially as you age. Number one. And number two, they tend to be inflammatory. And if you followed us, you know inflammation is the root cause of all aging, degeneration, and disease. And then number three, we always talk about it. We say one of the other big keys of your health is minimizing or reducing stress and then getting proper sleep. So those are the keys to helping maximize the effects of your testosterone therapy. So there's part one. I look forward to seeing you next week, and we'll continue this discussion. I want to thank you for joining me today. I want to remind you to subscribe to our YouTube channel. Leave us a comment with questions or concerns you have about your health. Follow us on Facebook and Instagram. For more health tips and information on the services we provide, go to our website. All of this information is available right here at the end of this video.